love this question because I want to bring awareness to other women like me. I found out at 35 years old that I had PCOS. Yes, I never knew my whole life that I had PCOS. I had pretty regular period. Let's start from the beginning. I had my period late 15, but I was an athlete. I was dancing a lot. I was doing competition, gymnastic, judo. So that's kind of normal to have your period late or to not have period for like a year or two. The first 2 years of having my period, I had them like I think twice a year. But like I said, I was training a lot. So that, you ask your OB and it's normal. It's called exercise-induced amenorrhea, I think. Don't call me on it, but I think that's how it's called. And then once I stopped doing this and I moved to America, then I started going into bodybuilding, powerlifting, and then I started dieting and then being into fitness and nutrition, and I passed my certification. So training and eating healthy is the only way to control your PCOS. So for me, I think that's how I didn't find out that I had PCOS, is because trying to eat pretty healthy, always working out, going on walks, doing all the things that you're supposed to be doing to control your PCOS. So I guess I controlled it indirectly without knowing I had it. And then I find out at 35. And in my whole 20s and my whole 30s, my period have been pretty regular. So to be exact, they're every 30, 32, 34 days. That's it. Some months, it can go up to like 38, 40 days. Or some months, once I remember I missed my period because I was extremely lean and dieting super hard. So when I exercise a lot or when I'm dieting too much or when I lose weight too fast, that's when I lost my period, which is kind of normal. A lot of athletes also miss their period when they are like super lean, which is the same like exercise-induced amenorrhea. So those I knew what they were caused by is because of my exercise and dieting too hard. But beside that, my period have been pretty regular. So when I don't, for me, 30 or 34 days is not the same. But for fertility doctor, that is not normal. They will tell you that you have to pinpoint which day on the calendar is your period coming. I was never able to do that because it's 30, 32, 34 days. It kind of varies. And if I'm dieting too hard, then it will like be pushed away. So for me, that was my normal. Never missed my period for 6 months in my 20s. And then when I started doing ovulation tracking, I was ovulating every month. And then some nurse practitioners like, oh yeah, PCOS, they don't ovulate. No, I ovulate every month. I tracked it at home with the ovulation sticks and I pee on the stick, and then I check my progesterone in the lab. Like I actually ovulated every month. So my PCOS was extremely well controlled. But when you have PCOS, you have hormone imbalance automatically because your testosterone is higher, your androgen level are higher. So I kind of knew that my androgen level were already high because of competing and stuff. I always used to do blood work just to check my body internally. And I always knew my testosterone was a little bit higher, but I was like, oh, it's because I work out a lot. So I was like, that's great. That's why I put on muscle so easily. That's why I carry more muscle. But no, it was a sign of PCOS. And when I brought those blood work to my fertility clinic before they did blood work themselves, that's how they found out, like, oh yeah, you have PCOS. I just look at your blood work and I knew you had PCOS. So if you show your blood work to a fertility or an endocrinologist doctor, they will tell you, I can see that you have PCOS without doing ultrasound on the ovaries. But I was officially diagnosed when they did ultrasound on my ovaries. Well, technically it was to do the salpingogram thing, and then they checked she saw my ovaries, and then she told me I had PCOS. But you go to a midwife, to a normal OB, you go to a normal doctor, no one ever saw it, even though they saw my blood work. But now that I know that I have PCOS, a lot of things make sense. Like I have a lot of hair. Some women, when I posted that video, was like, oh yeah, me too. But I have a lot of eyebrows. This is all natural. I have a lot of hair, and I also put on weight so easily, and I had to diet my entire life. And that kind of makes sense because PCOS, we automatically have hormone imbalance and insulin resistance. So it all goes together. Yes, I never had acne like most PCOS women. Yes, I never missed my period for like a whole 2 years or 3 years in my 20s and stuff like that. So that's why I never had a red flag or a red alarm to go see an OB and check what was wrong per se. The only way to find out really what was wrong is to do blood work. And then the other fertility doctor said like my hormone imbalance also will change the pH of my cervical mucus, and that also, I don't know, there's a lot of other things, it's not just like testosterone, but also like my estrogen level is not the same level as some other women. My progesterone is lower after I ovulate. So when I got pregnant and I get my progesterone checked at the lab, it was lower than what they wanted. So all those hormone imbalance, I was told it was caused by the PCOS. But I think there's also women that have low progesterone without having PCOS, I think. So it's just, this is everything that I have, even though I can eat healthy, be healthy, work out, go on walks, do everything to be healthy, get outside, get some sunshine. There's things like this that, yes, my PCOS in control, but like lowering your testosterone or things like this, or getting your progesterone higher. Or now I find out that also that I have my thyroid I have hypothyroidism. So I have to take levothyroxine for fertility. When I'm not pregnant, it's fine. But for fertility, I have to take it. And all those things were not seen before by regular OB. They were not seen by a doctor because they don't do extensive blood work. They are not endocrinologists. They don't know anything about hormones per se. 70% of women are undiagnosed with PCOS, just like me, because it's not as easy as like endometriosis. A sign of that is to have painful period, right? The same way as PCOS, a sign of PCOS is to have a regular period, right? But it's not one size fit all. We're all women are different, all body are different. And I think there's 5% of women that have endometriosis that are undiagnosed and that don't have any painful periods. So yeah, the only way to get diagnosed with all the things is to really, really go to endocrinology, to a fertility doctor, and do all the blood work, all the testing, all the ultrasound necessary to get fully diagnosed.